How's it going, everybody? Michael Fenster, chiropractor, House of Chiropractic in Avondale Estates, www.inspinewetrust.com. Today, we are going to be going over a presentation that I put together called Work From Home Syndrome, but really you can just say that this encompasses anyone who sits behind a desk for extended periods of time. So if this is you and you are looking for solutions on how to get yourself out of that and also help yourself chiropractically, this is the presentation for you. Please give us a call, 404-242-2164. Again, inspinewetrust.com is the website. We are in Avondale Estates on North Clarendon Avenue, 8 North Clarendon Avenue, between Arepa and the Tudor Village storefronts here in the heart of Avondale Estates. So let's get started and we'll switch over to screen share on Zoom. Okay, so like I said, today's presentation is called Work From Home Syndrome. But again, we really want to remember that this can really relate to anybody who sits behind a desk, who is on a computer, who is doing computer work, who is sitting all day and finds themselves needing to stretch all the time, pain, etc. This is for you. So this is what we call typical work from home posture or behind the desk posture. This happens to be a photo of someone who looks very familiar to me. It's me, haha. But as you can see here, we're really dealing with the two main areas of the spine, the very top and the very bottom, what we call the cervical spine, where the neck reaches the head and connects into the upper part of your back, and the other part, which is the lumbar spine, here at the bottom of your spine, where it connects to the sacrum at the bottom, L5, and the thoracic spine here at the TL junction, where the thoracic spine becomes your lumbar spine. So really, I invented the word work from home syndrome, but I did not invent the terms upper cross and lower cross syndrome, which is really what we're going to be talking about today. So that really means tight muscles and weak muscles, which we'll go over the anatomy of that. How does this relate to the spine, the actual bones of the spine? Symptoms that you may be feeling if this is something that you're suffering from. Why is chiropractic so essential? We'll talk a little bit about workplace computer setup and workplace wellness movement. Very important that you are sitting correctly, and if you are sitting all day, then you should also be standing as well and switching back and forth with that. I'd be more than happy to come into your office and show you how to set up your workstation better, or at least get you up and moving a little bit. And then what to expect when you come into the House of Chiropractic looking to get chiropractic care. So here's upper cross syndrome. Here's what we're talking about. So we're talking about what we call weak and tight muscles, right? So really at the end of the day, the cross is that X that's through the neck there, and you have a set of weak muscles and a set of tight muscles, right? So the tight muscles need to be stretched and the weak muscles need to be strengthened. Exercises exist for these, and you can find these everywhere, but basically at the end of the day, you need to be tightening, you need to be strengthening what's tight, what's weak, and stretching what's tight. Your pecs are tight with upper cross syndrome. Your upper traps and suboccipital muscles here at the base of your skull are tight. In upper cross syndrome, your neck flexors here in the front are weak, and your shoulder mid-back muscles, your rhomboids and lower traps are weak. The spine plays an important role in these muscles because muscles have origins and insertions. They originate off a bone and they insert into a bone. And the neck flexors originate off the front of the cervical spine and the base of the skull, also known as C1 atlas and occiput C0. It's kind of deep inside where your spine meets your skull. Okay, so if your spine and your skull are out of alignment, it can create muscle tightness or weakness, neurological pressure, and that's where chiropractic comes in. The suboccipitals, those other muscles that we were talking about, they originate off the base of the skull, here on the back of the neck and the head, as well as atlas and axis, C1, C2, and occiput. Again, very important, the very top. If you are suffering from upper cross syndrome due to work from home syndrome, or just sitting too much, or even you could even be standing but your head could be too far forward, that is, these are symptoms that you could be experiencing. Headaches are usually bread and butter chiropractic symptoms, meaning that if you're having headaches that are repeated in the same spot over and over, like a tension headache, cluster headache, migraines over the eyeball, even hypertension, and there's a lot of research that shows that chiropractic can help hypertension, but besides that one for this specifically, then this may be something that you're needing to have a chiropractor take care of and look at. When we move to the bottom portion of your spine, there's lower cross syndrome. Same idea, a set of weak muscles and a set of tight muscles. Now, when we talk about the weak muscles, we're talking about your abs, the superficial ones that make your six-pack, but also the deep ones that you can't see, and your gluteus maximus muscles. These actually really encompass your core. And everyone thinks core, they think abs, but you cannot forget about the glutes for your core as well. And then we have the tight muscles, the thoracolumbar extensors, which connect to the spine, as well as your hip flexors, which connect into your femur. And actually, they come off of the pelvis, which is what constitutes your hips, basically, and the anchor of your spine, and they connect into the leg to help it move, specifically flex, like bringing your knee up to your chest. So the tight upper leg muscles, the hip flexors, the tight low back muscles, thoracolumbar extensors, the weak core muscles, your abs, and the weak core muscles, your gluteus maximus. Here's that spine anatomy that we were talking about. Again, muscles have origins and insertion points. And like I said, these flexors originate off the pelvis and connect into the leg to help you bring your knees up. That's called abduction or abduction or flexing. And then there's specifically the pubis bone, which is the lower third of your pelvic girdle, and that is where they connect to. Same idea with the gluteus maximus, medius minimus, and even the piriformis muscles, the big, large muscles there coming off the back of the spine, specifically the medial part of both those bones, and the sacrum. The sacrum is your anchor of your spine, and if that's off, then again, these muscles can be tight or weak, and left unattended to for a long period of time then can create issues, which we'll get into in a second. Symptoms of this low back sitting too much syndrome, work from home syndrome, etc. You can have lots of stuff, just generalized low back pain, but usually, specifically, people will feel what they like to refer to as sciatica. True sciatica oftentimes can be coming from the spine, but oftentimes it can also be coming from the piriformis muscle, which happens to be right there next to the sacrum, and your sciatic nerve, which is your largest nerve in your body outside of your spinal cord, can get pinched off by a tight piriformis. So again, you have to have a chiropractor take a look at this. So what does it really mean? At the end of the day, it just means it's all about the top and the bottom of the spine. If you are not getting those two areas checked, then we're really leaving it kind of up to chance whether or not your body is going to be functioning at 100%, symptom-free or not, but really we want to try to avoid what we're about to talk about right now, which is spinal changes that cannot be reversed. And that is arthritic changes, disc degeneration, and reversal of the spinal curve. Now, not saying you have arthritic changes because your back hurts, but if you have had low back pain for a long time, or you've been sitting your whole career 8-9 hours a day, and then you're sitting in your car driving home, and then you get home and you're sitting on the couch, well, you are susceptible to arthritic changes, as you can see here in this image. Basically, the very top of that lumbar spine with that blue disc, that's about as good as it gets, although there is a little bit of change there arthritically between the discs. But as you can see, as we go further down the levels, that blue starts to dissipate, and we start to get arthritic changes and disc degeneration, and those little fluffy things at the back there, that is facet arthrosis. That also inhibits movement and can pinch off some of those yellow lines there, which are your nerve roots. Unfortunately, once this has happened in your body, we can't change it. And the only way to really prevent it is great spinal movement. Chiropractic, exercise, stretching, all of that is very important. As well as when we talk about the neck and the reversal of the spinal curve. So the black and white x-ray on the far left is what we call textbook normal. It should be a forward-facing curve. So if we look at my neck from the side, the neck curve should be forward-facing towards my face. Most people have a little bit of change in the curve, but if your head's forward for a long time or down, looking at your screen for days and hours, weeks, years on end, we can start to get straightening of that cervical spine. Eventually, reversal of the cervical spine. At that point, then we have arthritic changes. Same idea in the low back, pinching of nerves, etc. Symptoms. Don't wait until it gets to this to come and get in and get adjusted. You really want to start focusing on this stuff now. Hey, what's up, Homer Simpson? So, he's got a good little setup going here. He's got a donut, cup of coffee, plate of mush. He's watching Itchy and Scratchy. He's got his feet in a foot bath. This is, obviously a joke, but really importantly that, your workplace setup needs to be optimized for energy and performance, right? If you're sitting all day, your energy levels are probably down. You're easily distracted. You're on the internet. I suggest standing up. Get your monitor eye level. And when you're standing, you don't want to be leaning to one side or the other. You want to make sure that you're standing upright. A sit-stand-desk combination is a great idea, something that allows you to sit and stand well during the day. So let's say you've decided you're coming into the House of Chiropractic, it's time for you to get adjusted, you want to take care of your spine. Nothing happens overnight, and what to expect when you come in to the House of Chiropractic is some form of a treatment plan. Everyone's treatment plan is different. But I will say that in the beginning, if you are in pain and there's things that we need to work on, that you are going to be coming regularly, a little bit more in the beginning than you would be down the line once we've got your spine moving and you're on the road to recovery, as they say. So expect to come in a lot in the beginning, right? Why? Because your body changes slowly and we need to retrain it to do what it needs to do better. So what we call phases of care here in the office, and we have payment plans, or you can also pay as you go. But to give you an idea of what that would look like, let's say you're coming in with some acute pain or something that's been bothering you for a long time, or you've had low back pain, but now all of a sudden it's gotten worse, or it's on the other side, or whatever, something's changed, it's progressing in the wrong direction. You can expect to come about 2 to 3 times a week for the first month, so we'll call that 12 visits in month 1. Then we bump it down to about 2 times a week, maybe once every 3 or 4 days, for a total of 6 to 8 visits in month 2. Month 3, ideally, you're feeling great. You're like, Doc, I love this. Why do I need to keep coming? Well, we need to maintain those changes that we've made, but your body is heading in the right direction now, so you come once a week. In a 90-day span, right, we call that about 24 visits. Now, ideally, someone's looking to get better faster, and the best way to get to a pain-free, symptom-free way of life is through time and repetition, right? So even though you might be feeling a little bit better right away, you got to keep coming to make sure your body is heading in the right direction. Think diet, the gym, new habits, right? They don't get set in stone like that. You have to give your body a chance. So what does that look like payment-wise? Well, we have a couple different options. The first visit's $99, and we go over your health history, chiropractic exam, posture, etc., and first adjustment. That's a 30-minute visit. That's $99. If you decide you want to come, but you want to pay as you go, and you want to just sort of pay each time you come in, that's $50 per visit. Ideally, you decide to come regularly in some fashion, and we have a couple options for that. If you want to really just commit to getting adjusted once in a while or once a week, we have what's called our once a week wellness, or the monthly plan. That's $175 per month. It's a 3-month commitment, but it's $44 per visit if you broke it down, so it's a little bit cheaper than paying as you go. And then we have our 90 days to change. That is $849 upfront. It ends up being $35 per visit. That's 24 visits over a 90-day span, like we talked about. And that is how we really take your body from point A and get it to point Z. It takes time. It's not A to B, it's A to Z. So, thanks for tuning in. If I could leave you with anything really here at the end of this presentation, is to remember to keep it moving in some way, shape, or form. If this resonates with you and you're like, wow, I'm just sitting at my desk all day, I'm sitting in my car to and from work, I'm sitting on the couch watching TV when I get home, I'm sitting at the dinner table, all I do is sit. I implore you to give us a call, check out the website, inspinewetrust.com. The phone number is 404-242-2164. Remember, nothing happens overnight, but we can certainly get your body heading in the right direction. Thanks again for tuning in. If this resonates with you, also please pass it along, let people know, reach out for any sort of questions, etc. And I look forward to meeting you and seeing you in the office soon. Have a fantastic day. In Spine We Trust. Dr. Mike, signing off.